So I'm not going to talk too much scientifically. I'll try to be more practical. So when we are talking about disc pathophysiology, I think after today's lecture, we know everything about it. I think the most important thing now is to know that we are losing some cells, water, and we are getting some annular tears with some nerve ingrowth, and what is happening inside the disc environment in inflammation and also pathological vascularization. When we look at this MRI, what is wrong on this MRI? When you look at L4, L5 disc, it's a little bit of degeneration, nothing special. When we look at multifidus muscle, there is some fat degeneration as well, but if you are a normal human being living a normal life, most probably you will manage without any significant problems. But unfortunately, this is not a normal human being. This is elite Swedish cross-country skier